Hello, this is Gerie DiPiano, and you are listening to or possibly viewing the Love Mia Vita podcast. My guest today is Dr. Anthony Benedetto, not to be confused with Tony Bennett, who, by the way, had the same name, Anthony Dominic Benedetto. This is a real doctor. He is an MD, and he has such an incredible pedigree. So Dr. Benedetto is a professor of medicine, of clinical dermatology at the University of Pennsylvania. And he also has a practice in Philadelphia and in Drexel Hill, Pennsylvania. But Dr. Benedetto, please share a little bit more about your background for those listeners who may not have tuned in to our previous podcasts.
Well, I've been in practice for over 40, maybe 45 years in Philadelphia. I'm originally from Philadelphia. Did my training at the Cleveland Clinic in dermatology and also in dermatologic surgery, which included Mohs surgery. I think many patients now, or people now, are aware of what Mohs surgery is. It's surgery to remove cancers of the skin. And it's a microscopic technique where it's a tissue sparing technique where we remove only the cancerous tissue. So either small or large lesions can be removed very conservatively and completely. And like you said, I practice in Philadelphia and in the Drexel Hill area, and our practice extends after treating patients for different dermatologic conditions and serious cancers. We then have also expanded into the cosmetic arena where we do a lot of the different laser treatments for different serious problems and cosmetic problems. So we have a variety of things and patients that we treat, and we're very comfortable here in Philadelphia and in Drexel Hill in Delaware County.
I'm going to put another plug in for Dr. Benedetto and his practice. And without disclosing any personal information, I will have to say that Dr. Benedetto's bedside manner is just absolutely incredible. I sent a very close friend to his practice, and he is the type of healthcare practitioner that is sensitive and caring about his patients. And I will tell you that she had the utmost of caring experience working with Dr. Benedetto, young woman, frightened, concerned about potentially a cancer diagnosis. Thankfully, everything turned out exactly as it should, but Dr. Benedetto treated her with kid gloves, and that's the way he treats his patients. So not only does he have an incredible pedigree, but he is a caring physician. So just wanted to share that with our listeners because you deserve those sorts of accolades.
Well, thank you very much. You're too kind. Thank you.
I'm not too kind. I'm being honest. Today's podcast is about a related condition called Lichen Sclerosus and lichen planus. And these are conditions that sometimes are confusing because they present themselves with itching and burning and pain and fragility in skin. And most of these conditions are considered autoimmune conditions. And we find them in different populations, largely in the female population, which is why Dr. Benedetto is on the Love Mia Vita podcast, sponsored by FemPharma. But they can present in men as well. And they tend to find themselves on genitalia in two populations. One is a younger population of prepubescent females, but perimenopausal and menopausal women often have signs of either lichen sclerosus or lichen planus. So Dr. Benedetto, what are these two conditions? Help us to understand what they are.
Okay. Lichen sclerosus, the old name was Lichen Sclerosus Atrophic. It explains or it identifies what we see under the microscope. Now it's called lichen sclerosus, it's shortened. It's much different than lichen planus, even though it has the same identifier as lichen. Lichen is what grows on trees or whatever. Has nothing to do with that. Has nothing to do with an infection. Has nothing to do with any microorganism or whatever. It's just the appearance of it. It's an old disease that has been identified for maybe a couple hundred years. Typically, it is seen, lichen sclerosus now is typically seen in the genitalia. It can be seen on the body elsewhere, on maybe very rarely on the arms and legs, but they are sort of patch-like areas, lesions that look like cigarette paper. It's very thin and kind of whitish and wrinkly. And the old name sclerosis atrophicus, it's atrophic, it's very, very thin, but if you touch it, it's very sclerotic or hard, hence the name lichen, because it has this patchy, like a fungus on a tree or a lichen on a tree. So it had, and that's where the name comes from. It's not really a medical term, but it's a Latin term. And it has very distinctive appearance under the microscope, very easily diagnosed most of the time. But the real problem with it is that it can lead to cancer of the skin. So the longer it exists, especially if it is untreated, the more likely one is to develop skin cancer. And that's why, as a dermatologist, that's part of my bailiwick. This is my area of treatment and expertise. Since I'm a Mohs surgeon and I treat a lot of skin cancer, well, Mohs surgery is for skin cancer, and we treat skin cancers. I've been doing it for thousands of patients for over 40 some years. Unfortunately, sometimes skin cancer appears in the genitalia or around the mouth or whatever. And this is why, as a dermatologist and as a Mohs surgeon, it has become a focus of my attention. And so luckily, and I did not realize this early on, there are some medications that can be used that will actually treat the problem if used correctly, and lichen sclerosus can disappear. To my surprise, and this is what my surprise was, I thought it was a lifelong problem, that it was could be very debilitating, and that's true. But if you treat it, it doesn't have to be, and it actually does disappear after months, usually 6 months to a year of constant application of a very strong steroid, a cortisone type medication. The problem does soften, and that hard sclerotic tissue becomes normal appearing, and the white plaque disappears and becomes pink and thick again, just like regular skin or mucosa. So that's the one problem, lichen sclerosus. Lichen planus is another autoimmune problem related to maybe thyroid disease, or if you have lichen planus, you have to be careful of thyroid disease and diabetes. That typically, more so than lichen sclerosus, appears on the extremities, around the wrists. It has nail changes. It can have hair changes. When it's in the scalp, it's called lichen planopilaris. Maybe men and women are affected evenly, just as frequently, whereas in lichen sclerosus, it's mostly women and young girls, prepubescent girls. And it's not really seen. I don't think I've seen it in the younger adult, children or adolescents. It's mostly an adult disease. I could be wrong, but I think that's the case. And it's itchy little bumps that look like a cheese grater or a nutmeg grater. It has that appearance on the inside of the wrist and around the ankles. Then if you look in someone's mouth, it has this lacy appearance on the inside of the mouth. And that's one of the telltale ways to make a diagnosis of lichen planus. And then, unfortunately, in some women, it becomes a vaginal problem, a vulvar problem, but more vaginal. Lichen sclerosus is more vulvar, which is outside skin. Lichen planus is more vaginal and mucosal, just like inside the mouth. It's in the inside. It's called the introitus, the early entrance into the vagina. The real problem with that is, and thankfully it's not that common, it causes scarring. And it can eventually, if it's untreated, the scars become more frequent. There's bleeding in the vaginal area, and it actually shuts down the vagina. You can actually close down the vagina from scarring, from sclerosis, because of untreated lichen planus. Both problems, like you said, have itchiness, soreness, difficulty with intercourse, and then the real problem is with lichen planus, the closing of the opening of the vagina, and then the eventual development of skin cancer and mucosal cancer. So that's the long and short of it. Did I answer most of it? I could keep going, but
Yeah, you're obviously answering a lot of questions. So when we hear about women, and we actually get questions on our customer service line, when we hear questions from women who express concerns about burning and itching and dryness and painful intercourse, they will often ask the question, do you think I have lichen planus or lichen sclerosus? Mostly lichen sclerosus. And we are not equipped, we're not physicians. By the way, nothing that you hear on this podcast, even though Dr. Anthony Benedetto is a board certified dermatologist and expert in the field, it doesn't replace visiting your healthcare professional. And by the way, neither do we profess to have that sort of clinical expertise and provide you that advice as FemPharma. What we try to provide is information. So what we often hear from women who contact us is that they have burning and itching and dryness. And we can't diagnose over the phone. And so what we often suggest to those women who are calling in is to take a mirror and to examine their genitalia. And if they see these types of signs, and you describe them, looks like white cigarette paper, or it looks like white patches, perhaps it starts at the clitoral hood and then extends downward in a key-like fashion. So there are some signs that might suggest, and I use the word suggest, that this is an issue. And then they should be seeing a healthcare practitioner, a dermatologist or a gynecologist, but certainly someone who is a clinical practitioner, board certified physician. And it's often confusing, right? So this is really helpful for you to explain to women what they should be saying and perhaps what the next steps are. We don't want to scare anybody here, but yes, if it's left untreated, as you suggested, it may lead to something more serious.
correct. I do want to add, though, you get a across the board solicitation by phone where women ask, what they might have, if they have itching, burning, difficulty with dryness and sexual intercourse. After a certain age, when there's no estrogen, they could have the common atrophic vaginitis, which means that the mucosa is just dry and not as lubricated as it used to be. So that's the first thing that occurs. The second, like maybe 5% of women who have that type of sensation and symptoms can develop lichen planus. Then, no, I'm sorry, lichen sclerosus. So about 5% of menopausal women and even premenopausal women that have these symptoms aside from atrophic vaginitis, it's lichen sclerosus. And about maybe 0.5%, a smaller percentage, maybe 1%, will have lichen planus.
So
Excuse me.
issue. So what is the cause? Is there a known cause of lichen sclerosus or lichen planus?
No, not that we're aware of. There are some genetic studies that are currently scratching the surface, but it's early studies, and it's not even worth even discussing.
Yeah, so the cause is really unknown. Family history, is there anything that would suggest that perhaps if you had say a first degree relative, mom, sister?
That can occasionally patients say, my mom had something similar to this. So it can run in families, but it's a very loose association. You can't say, like 1 in 1 or 2. It's like very, very rare also. So it's not something that, just because a cousin or an aunt or your mom or grandmother had it means that you have the same thing. So it's not the same thing unless you're examined and a diagnosis is made. And sometimes the diagnosis has to be made with the aid of a biopsy, a sampling of the skin, a piece of tissue that's sent to the pathologist. Like I said, these types of lesions are very distinctive under the microscope. And that's basically, that's the 100% definitive diagnosis. But most of the time, as a dermatologist looking at skin lesions, I would say 95% of the time I can make the diagnosis without the biopsy.
So we don't know whether there is an underlying cause. It's sort of, and this is, in the medical literature, one will find this. So if you're using Dr. Google, which I don't advise, by the way, because you're just going to scare yourself. But if you happen to use resources on the internet and you use erudite publications and you're researching this on your own, the etiology or the cause is really unknown. There may or may not be a genetic predisposition. We talk about other autoimmune diseases. So if you have one autoimmune disease, this has often been referred to as an autoimmune disease. Is it likely that you may have this? So does research?
Not necessarily so. There is another type of sclerotic disease called morphia. And sometimes under the microscope, it's difficult to distinguish between the two, but most of the time, a good dermatopathologist will distinguish between morphia and lichen sclerosus because there's a certain pattern of inflammation that distinguishes it. So there are little subtleties that are seen by pathologists, dermatopathologists under the microscope that refine and pinpoint and direct the diagnosis and help a physician by identifying specifically what the problem is. So the different problems require different medications and different treatment modalities.
So it sounds like in order to, if you see this, so let's assume that you're a woman that is experiencing itching, burning, and dryness. Could be nothing more than just vaginal dryness, nothing more than that. Right. And with a good vaginal moisturizer applied, water-based moisturizer that's applied to the vulva. And if you have problems with vaginal dryness inside the vagina, make sure that it's FDA cleared, by the way, because you want to make sure that you have good testing. That may be all you need. Take a mirror. Sometimes women are a little hesitant to do that, but take a mirror and take a look. And I think you mentioned that you advise your patients to do the same.
Absolutely. So during an exam, a session where we've now identified a problem and they have to apply some medication to an area, it's a wide area. If it were on your nose, you know exactly where to put it. If it were on your forehead, it would be easy because you're looking in a mirror. So we have large mirrors with a large extended handle, and we give it to our patients and we instruct them. And I help them to identify specifically where I want them to apply the medication. And I encourage them, to monitor, you have the problem. You see what it looks like. You see the different color changes. Now, when you're using the medication, it's going to change. You need to know when that happens. You need to know, if you're using it twice a day, you need to know when to start using it once a day, or when, if it's not working, when to use it 2 or 3 times a day. So there's a scenario that you have to follow, a protocol, and you can't do it with a pillowcase over your head, right? And when you're in front of the mirror, you got to take the pillowcase off and take a look. And that's basically what I tell patients.
And, we're chuckling, but let's face it, it's
The reality.
We've learned that there are some women that have never examined their genitalia, but when it comes to a potential problem like this, you want to see what's going on and determine whether this could be vaginal dryness that is a function of natural or chemical menopause, or some medication that you may be taking that resembles or that causes dryness, or whether it is something more that needs to be investigated by a dermatologist or a gynecologist. And if that's the case, then encouraging women who are listening or viewing this podcast to see a professional is really important, because as you mentioned, the treatment is with steroids. And
Right.
it's recommended, and steroids are prescription products that are recommended by your healthcare practitioner. You cannot, well, you could get them online. We know that that's possible, but you want to see someone in person. So someone like Dr. Anthony Benedetto, or someone in his capacity that is board certified. Then what about continual care? So we talk about the other issues associated with this, the dryness, the burning. Are these women able to use a vaginal or vulvar moisturizer?
Yes. Well, if they have just atrophic vaginitis, yes. If they have lichen sclerosus, in between time, because you're to use the medication, the strong steroid, morning and at night, just twice a day. What happens in the middle of the day when you're active and your things are going on that are important? Yes, the answer is yes, as frequently as will symptomatically make you feel better. And the same thing with lichen planus, especially even with lichen planus. That can be, because it's mucosal, it's more intravaginal. Yes, the answer is yes, using a moisturizer. Like pharma products is really important that they at least get to know how to use them and see if they work for them particularly.
So when we talk about a moisturizing gel, we often think about different types of moisturizing gels, and water-based moisturizing gels, which resemble the vaginal and vulvar pH. It's really important. You don't want it to be irritating, so we want to be sure that you use pharmaceutical grade ingredients. Make sure that you check that these products have the appropriate testing.
Correct. I do want to also veer off on another modality along with moisturizers and topical steroids for atrophic vaginitis. There are laser treatments now. And we, as dermatologists and laser users, we also have a laser, and I'm not going to say the brand, but there's at least a half dozen different types of lasers and different brand names. I'd like to know that I have one of the better ones, if not the best one on the market, but that is a solution also. In between treatments, using moisturizers, steroids, and it's more for atrophic vaginitis and urinary stress incontinence. But that's a different topic we're not going to talk about.
Well, you're absolutely right. So we're a big proponent. So you'll hear on the Love Me Avita podcast that we believe in women's health equity. And the more options that are available to women to help to attain women's health equity, the better in our viewpoint. We may not be the company that offers all of these options, but we encourage women to research those options and to find resources such as Dr. Anthony Benedetto, who offer some of the more novel and more groundbreaking opportunities to address these problems. Because the goal is really to find a solution to your particular problem. And that means that you have a practitioner like Dr. Anthony who is thinking far ahead and thinking more assertively about what can be done to address your health care. So Dr. Benedetto, I am right there with you. If this is an option that a woman wants to consider, she should absolutely do her research, find the right practitioner, and determine what the right option for her and for her particular condition may be. So yes, all of these are great ways in which to address some of these symptoms. And in the case of lichen sclerosus and lichen planus, you heard from one of the key experts. You want to see an expert, you want to visit someone, you want to rule out other issues and then proceed.
Correct. Because there are other particular issues that are related to other generalized conditions of patients and other immune type of problems that can relate to the vaginal area or the anal genital area, the genitalia. I mean, there are dermatology is replete with all kinds of strange changes of the skin, from pemphigus and blistering diseases. And the other problem are warts in the genital area. Again, that's another condition that may lead to skin cancer. HSV, which is human herpes simplex virus. It's when you hear herpes, everyone gets a little, upset. But chickenpox is a herpes virus. So herpes happens to be the genus of the virus that has been identified, and there are different conditions, chickenpox and blistering of the lip or the genitalia or elsewhere on the body. It's shingles, and that's herpes zoster. So there are different conditions that, if you look at them in a textbook or if you see a patient with them, they can be a little scary. I think that's one of the reasons why I went into dermatology. They were very interesting for me, but they're very significant and very important to recognize and to treat. And if you recognize the beginnings of these problems on yourself, it's really important, like you say, to go to a practitioner, a practicing clinician who has the ability to make the diagnosis and to select the proper medication and modalities for getting rid of all those problems.
So you just heard this from an expert, professor of medicine, clinical dermatology from the University of Pennsylvania, someone who has practiced dermatology for over 40 years. So we consider you an expert, Dr. Benedetto, and so should women that are listening to the podcast. But this is the opportunity for you, if you are curious about whether your particular skin condition, in this case, lichen planus and lichen sclerosus, is something that needs to be further investigated. Please accept the advice to visit your healthcare practitioner. Dr. Benedetto has shared some of his expert advice, but he's not your personal physician. He could be if you live in the region, but you should see your healthcare practitioner to rule out any potential consequences that may result in something more serious. And hopefully that's not the case. So take a look, take a mirror, do a self-exam. And if you see something that concerns you, whether it's blistering, whether it's a white plaque, whether it is excoriation or something that looks like tearing in your vaginal or vulvar area, please do take the next step and see a professional. Dr. Benedetto, it is always a pleasure to have you on the Love Mia Vita podcast. And to those of you that are listening or viewing this, we hope that you will continue to tune in. We hope that Dr. Benedetto will be our guest again to talk about these topics. We always enjoy having him. And as I said, he's not only an expert in his field, but he is also a compassionate practitioner of medicine. And we thank him, and we thank all of the healthcare practitioners who treat men and women with the care that they would also provide to their family members and loved ones. So Dr. Benedetto, thank you for joining me on the Love Mia Vita podcast.